everyone, and welcome to Supply Side West Food Ingredients North America. Welcome to the Supply Side stage, and welcome to this session on addressing health inequity. I've got a few announcements to get through before we start. Of course, please download our mobile app. It's going to help you get oriented and have all your schedules, and the more you interact with it, the better the AI is. That's how that works. So you'll get recommendations. It's really great. If you need Wi-Fi, and who doesn't love Wi-Fi, information on the slides right here on how to get that. Oh, that QR code will take you to that app I was just referencing. The expo hall closes at 5:30 today, and we've got a couple of networking receptions that we would love to see you at and join us today. I'm Sandy Almendaris, Vice President of Content, and the goals and objectives of this session are to uncover some white space opportunities for helping enhance consumer health. Where are some places that the supplement industry has not yet addressed, where business can find success and also help create healthier populations? We're going to discuss the needs for inclusivity within dietary clinical trials so that we are really serving a wide variety of consumers, and we're going to share insights around the market need and go-to-market strategies. Your moderator today is Heather Granado. She is the president of NutraAchievement, and I will leave it to Heather to introduce the rest of the speakers today.
Excellent. Thanks so much, Sandy, and absolute pleasure to be here. So I'm really excited about this topic. When I was originally thinking about it, I'm on the board for the Organic and Natural Health Association, and we've done some work looking at the vitamin D deficiency in the United States. And when you think about the opportunity that we have to really make an impact on people's lives with the nutritional products we make. So we talk a lot in the nutrition and wellness industry and say, our products make a difference in people's lives. We want to bring more health to more people. And then I go to the store and I see lots and lots of products for women who look exactly like me. And I don't see a lot of products or accessibility for people who probably don't have the same access to diet that I have, or the same nutrition and the economic security that I have. This to me is a huge opportunity when we start thinking about who are the other people that we could be serving within the nutraceutical industry. There's a role for government, certainly, the opportunity to use SNAP benefits to have dietary supplements and a basic multivitamin. You could have healthcare providers get more nutrition education so that they're talking about healthcare, they're talking about prevention and not just disease. But we as an industry have an opportunity, and this is an opportunity to actually do more business and serve more people throughout the entire supply chain. So I reached out to some amazing people and said, what if we talked about this as an opportunity? Not saying, oh, shame, but let's look at it as business. So our first speaker today, she's got more than 3 decades of industry experience. She looks at market research, innovation, and consulting. All of this tied up in insights and strategy. She's got the numbers, and I know everybody loves the numbers and taking pictures of slides, so we'll have a couple of slides for you. She loves the idea of consumer health and environmental wellness and how these connect together. And when we originally connected, this was a topic that we both got really excited about. So the VP of Total Wellness at Nielsen IQ, Sherry Frey, I'm turning things over to you.
Fantastic. Great. I thought I would cover just some data really quickly in terms of some of the trends and kind of the understanding of the opportunity. But first of all, I just want to say thank you for all of you for being here, because I was so thrilled when Heather said, let's do this as a topic, because this is so near and dear to my heart and it's so important. And I do really believe there's a business case for this. As you know, we continue to have health challenges. This is a look at what we track in the US. We track every year all of the consumers in our panel and what they or someone in their household is self-reporting. And as you know, this continues to be a negative trend that we have in terms of chronic diseases in the US. And it tends to be, many of these, this is kind of the percentages of these across our total panel. But when you look at some of these for lower income households, they're oftentimes 3 to 5 times more likely to have many of these challenges. So the opportunity for prevention is really, really key. And I think I'm so glad you brought it up, because this mixture of diet and supplementation, kind of like how does this all fit together? When you look across the country, what we color-coded there on the map, those are where healthy food, either nutrient-dense or heavy produce or fruits and vegetables are sold. And you can see, we tend to, index higher on the West Coast. And that's also, you can see that's where we're indexing higher in terms of vitamins and supplements. And you kind of can compare this map, and I'm not at all saying this is a correlation, I'm just showing you a side by side, but look at these two maps compared also to the chronic diseases of diabetes, hypertension, heart failure, right? So there is an opportunity here. And when you think about what has happened with online, I think one of the most exciting things is it's actually opened up access for more consumers. It's not that they have to go into a specific store for the supplements, or they have to feel, kind of like overwhelmed with going to a set. They've got more opportunities for these products to be fed up to them. And so this is a look across vitamins and supplements in terms of the share of products that are sold in store versus online. And I think, I actually have only shared this slide a few times, but when I share it with people, they're like, wow, I had no idea how many supplements is actually sold online. And that kind of varies across the board. But what I really want to call your attention to is those household penetration numbers there in black. The fact that, yes, okay, for overall vitamins and supplements, we're at about a 90% in terms of household penetration. Look how much upside there is in terms of consumers and household penetration, even on something as mainstream as the general health, and all the way to things that are very specific around diabetes. So there is so much opportunity just from a consumer standpoint. And again, a lot of that's been driven by the direct to consumer, the new channels, the avenues. We've been really fascinated. We started tracking TikTok Shop in the fall of 2023. And I actually didn't really think there was that people were really buying on TikTok Shop. It is the number 8 health and beauty retailer. It is the number 29 food retailer just since September of 2023. And so the really fantastic positive of this is, again, it's opened up access, it's put more products in front of more consumers, giving them that kind of availability to look at what might be relevant for them specifically. I just also wanted to share with you a little bit in terms of what does this look like in the data today. So in general, as you would expect, when it comes to total CPG or consumer packaged goods, we're just doing a comparison of VMS versus total consumer packaged goods. And as you would expect, VMS tends to over-index higher income, slightly, that 42 versus the 36.9. And then we actually took a look, though, this was really fascinating to us. We took a look at the top 20 brands, and we actually found, surprisingly, that the top 20 brands indexed high. In many cases, those are actually the brands there across the top. They indexed high for low income in many cases. So many of the large brands have identified and understood this is an opportunity to meet these consumer needs. And we also thought we'd give you a look at what's happening from a diversity standpoint. So when you think about, again, we're doing that comparison, the total CPG versus VMS, we tend to be about 69%, so slightly under indexing in VMS on white versus Hispanic and Black, Asian, et cetera. I think one thing that, we did some research 2 years ago, and we looked at all CPG brands, all the brands that in the VMS space, and we looked at who looked the closest to the US demographic in terms of the census. So, and by the way, there are very, very, very few brands that actually look like the demographics of the US. But we found that the ones that had the most diversity in their consumer base actually were growing the fastest. And so again, really illustrated that opportunity for the business case. And but although when you kind of flip that and look again at those top 20 brands, you can see that's not necessarily the case, and we tend to see a high indexing from the Asian consumer overall. So just wanted to give you a little bit of a framework of the lay of the land in terms of where we see some of the opportunities as the business exists today.
So what I find interesting there is you've got this idea of these kind of different racial, ethnic backgrounds. What does the opportunity then suggest? And working with women in nutraceuticals, we talk a lot about, are we representing our consumer base? Is there an opportunity perhaps for companies to think about bringing in diverse folks to think about doing the research, about doing the marketing, and being represented within your own company for the people that you are serving?
Yeah, that's actually a great point. One of the things that when we even did that research, with the diversity, the biggest thing that we wanted to make sure the industry didn't think was, oh, we just need to do a better job of marketing to diverse people. We wanted them to understand it has to come from the inside out, meaning that it has to be who you have in-house working on your business, developing the marketing campaigns, developing the products and then the innovation that has really got to be core to what you do versus this is not just a marketing opportunity.
That's right. And I know we'll unpack that further as we continue on our dialogue. But as we move forward, so we've got this idea first from, and I can hold on to that, Sherry. No worries. So we're talking about the opportunity that's out there. We then need to talk about, okay, how are we going to develop these products? How are we going to buy these ingredients? How are we going to make nutrition and nutraceutical products affordable for the people who really need them? So when I was thinking about, okay, who would be amazing at this? She's a global technical and business leader. She does strategic thinking as well as new product execution. So from the idea all the way through. The benefits, the market penetration, while also looking at the importance of quality and addressing costs when you're looking at quality. She's got a doctorate in pharmaceutical sciences and was delighted to see that she has joined Leaf Labs as Chief Science Officer. Dr. Chioma Ikante, thank you for being here, and I'd love to just open it up to you to talk a little bit about your experience and this idea of how do we develop products that are affordable and serve the right markets.
Exactly. Thank you, Heather. Very grateful for the opportunity to share this. This is an area that is very dear to my heart, because even before I go into developing products for this market, you need to understand the why. Why are we doing this? Sherry set a good stage just to understand the breakdown of the demographics and who is buying supplements. But why supplements? Because the reality today is that our diet is not possible to get all that we need from our diet. And we now know several studies have shown that nutrient deficiencies make changes, epigenetic changes, that transcend to several generations to come. And they alter the brain structure. Nutrient deficiencies alter brain structure, alter brain function. They impact neurotransmitters like serotonin, dopamine. Those are all impacted as a result of nutrient deficiencies. So the effect is huge, not just on the generation today, but the generation to come. That the status of a mom, even before getting conceived, have omega-3 status, even before conception, impacts not just her, but the unborn baby as well, and predisposes that baby to long-term negative effects and behavioral issues, cognitive effects on that child. So because of this understanding of the impact of nutrition, now even the gut microbiome is unpacking a whole lot more, telling us that the gut microbiome, which is mostly influenced by our diet and the supplements, because like I said, our diet is depleted of nutrients. So it's not possible to get all that we need from our diet. So when the gut microbiome is not getting the right nutrients, what happens? It impacts your health all the way through. We are seeing now deficiencies in omega-3, deficiencies in folate, zinc, all having behavioral issues. And there are now associations linking them to psychopathological issues down the road. So how do we develop products to meet, not just for the high-end consumer that has the money to spend on supplements, but also meeting to everyone, because everyone deserves this. It's the whole population, and all of us are impacted. So when we think about it, is really thinking about what are the key essential nutrients that people need to have. There are 8 essential nutrients that the FDA has recognized that these are nutrients of high concern. Public health concern is being recognized, dietary fiber being one of them. We don't get as much fiber as we're supposed to, and the impact is the fiber, when we consume fiber, both soluble and insoluble fiber, they go all the way, the insoluble fiber gets all the way to the colon, where they're now metabolized by colonic bacteria to produce short-chain fatty acids that turn around to now have impact on our health. When it's not present, what happens? Then you have all sorts of gastrointestinal issues, but not just gastrointestinal issues, that are also brain modifications, because we know through the vagus nerve that the brain is talking to the gut. Constantly, there's a bidirectional communication between the brain and the gut. So dietary fiber, that's something that we can easily formulate to make it available to everyone, including those in the low socioeconomic status. Proteins, for example, multivitamins, essential multivitamins, vitamin D. Heather talked about vitamin D. We see the outcome. When you look at several studies that have looked at COVID-19, for example, and those that had worse outcomes when exposed to COVID-19, those that had the worst outcomes were those that got into COVID when deplete of some of those essential nutrients like vitamin D. Those in the lower status had worse outcomes. So we see that when somebody is going into all of these exposures, which we are not immune from, right? The environmental insults, none of us is immune from it. But when you are better prepared, then your body can handle it better. So identifying those essential nutrients, calcium, magnesium being another one as well that is essential because we're not eating as much dark green vegetables as we ought to. So identifying those key essential nutrients, companies can have simplified formulations that should not cost that much and make sure that everyone has access to those basic nutrients that are already shortfall nutrients that are already public health concerns. I know there is a lot of advocacy, especially with the CRN, now even looking at the government including multivitamin as part of the SNAP program. That's going to be a huge impact because just providing a multivitamin bridges that gap so that people are supplementing and going into these major life issues better prepared to handle them. Omega-3 is one I talked about, very essential. Everyone should be. Probiotics is another one. Everyone should be, and making them affordable in a way. So contract manufacturing, I work for Leaf Labs, and at Leaf, we donate to non-profit organizations like Vitamin Angels, for example. And through Vitamin Angels, we're making available supplements to women and children that otherwise would not have access to these nutrients. And so making this more accessible, making it more affordable will make it easier for everyone to have access. And what happens is that the health of everyone is enhanced and it's generations to come that are impacted as well.
Yeah. Well, not only do we have the health enhancements, we've got reductions in healthcare costs,
exactly.
Which ultimately would be amazing for the U.S., certainly,
exactly.
to address that.
Exactly.
Yes.
Something as simple as even zinc. Did we know that that there's an association between your zinc status and hyperactivity in children with attention deficit disorder? It's something that can be very easily solved and very easily mitigated just by giving children and moms ahead of getting conceived with sufficient levels of zinc. Folate. Thank God that now we have a lot of foods that are supplemented with folate. It was a big deal before, but even just folate, there are lots of people in populations that don't have access to fortified foods that are still suffering the negative effects of having insufficient folate prior to conception and during prenatal and postnatal stages as well.
All right. Well, thank you, Chioma. And I know we're going to unpack a little bit more of this and also getting into the importance of collaboration within your own teams when you're talking R&D with marketing, with science, everyone working together. So actually, we're going to come over to our next speaker who has this insight in terms of identifying that right demographic. So he spent 2 decades at Vitamin Shoppe doing kind of everything. I looked this over. So you got R&D and quality and private label and sports management. Served as the chief brand officer at Universal Nutrition and has been a personal trainer and has this master's in nutrition science. But one of the things that I really love about this person is he brings this different perspective to bear from the experience that he has and is sharing that forward. When I said the type of speaker I was looking for and was speaking with one of my good friends, Gina Benninger, she said, "Oh, I've got the exact perfect person for you." He's the Chief Merchandising Officer at Well With All. Marvin Barton, thank you so much for being with us today.
Thank you for having me.
Yes.
You've been in the industry for a while when people start defining you in decades. So.
I know the feeling, right? Yes. One of the things that we talked a little bit about was the importance of taking a mindful approach to marketing. And I'd love to have you talk a little bit about taking a mindful approach to marketing, that it's not just, hey, I can take this product that I've already developed and I just pink it and shrink it, to use the sports analogy. But as we extend into different markets, what do companies need to be aware of? Can you talk us through that?
Absolutely. So I can speak for Well With All, what we've done, particularly when it comes to our go-to-market challenges. We rooted ourselves with the consumer. And how we did that early on was actually focus groups, surveys, using consumer data. But as Sarah, you were mentioning, there's the internal diversity, but we also looked at our partners externally. So we actually brought in a consumer insight specialist that actually helped us get those insights, the qualitative and the quantitative data for the consumer that we were looking for. And then from there, we actually took those insights And we use those to basically inform everything we do. So from events, our tone, our messaging, activations, we took the insights. Even when we do show up at events, how we show up at events was informed by the consumer. And I can tell you, from my experience at the Vitamin Shop, when I did work with those many brands, it was those brands that really understood the consumer and also understood themselves and the relationship with the consumer. Because that's very important to your point. It's not just about talking to them, but you have to make sure that you understand what that relationship is in your business, but also what's the relationship you want to have with the consumer. And those brands that really understood that, I found not only had a lot of success, whether it was from launching new products or new brands, but also when those challenges came, when they're ultimately going to, the consumer was a lot more forgiving for those brands because they were better able, they had a stronger relationship and understanding of what the brand was about, as well as the brand understood how to better communicate to the consumer.
So what are some of the common failures that you've seen in terms of companies that maybe don't understand their own mission and values and the demographic they're serving?
So, a story I can tell you to that, and this is a sports nutrition company. So there was an ingredient that was very popular, but it was also very controversial. And I had a conversation, and this one brand in particular did not have this ingredient in their product. And it didn't really align with that brand. And I remember having a discussion with the CEO, and I said, I don't think you should bring that ingredient. It doesn't match who you are, it doesn't match what you're doing, and there's a lot of controversy. But internally, he was getting a lot of pressure. And so they actually brought it in, and I don't know, about 2-3 weeks later, it was banned by the FDA. And then you go through the whole, turning back products, the costs and everything. So I think the lesson from that is, I think he listened to too many people, but they weren't really true. He wasn't true to his brand because that ingredient didn't match what his brand was about. Yes, it was very popular. Yes, they could have made some sales, but at the end of the day, the synergies weren't there. And I think brands need to understand that. Yes, you can get some POs. I would call brands like these PO chasers. And POs are great, we need them. But at the end of the day though, if it doesn't align with what your business is doing, it doesn't align with the values that you have in the brand, I would say past that PO, if you do what you're supposed to do, that next PO is going to come.
Right. Now, what kind of marketing and communication strategies might companies need in order to extend our base for the nutraceutical industry? It seems to me that often we're talking to the same people we have been talking to. What should companies think about to maybe start reaching out into different communities in a way that is authentic and resonates?
Absolutely. So, I think it comes back to partnerships and leveraging partnerships because we can't do it all alone. And so, for example, with Well With All, what we've done, and we've done this in early stages, is that we've partnered with a health center in the Boston area. And we've actually co-created with them the HEAL Academy, and you're going to ask me what HEAL, Health, Education, Advocacy, and Leadership. And basically what we did was we brought in some students and taught them how to take blood pressure, the benefits and the importance of understanding your blood pressure numbers, and then sent them out into the community. And that community was, the healthcare center was having trouble getting some of the community members in. And so by there, they were kind of spreading their wings and getting in to help, change the trajectory, hopefully, of some of these consumers. And so I'm just using that as a non-traditional example of a brand partnering with someone who, yes, okay, it wasn't necessarily promoting our brand per se, but we were trying to do good in the world. And so having those partnerships, I think, are key. What I also often see is brands will do a lot of collaborations with other brands, which I think is great. But oftentimes, they're talking to the same consumer, right? And so I think finding those institutions or leaders where you want to be, who you want to talk to, as long as it aligns with your values of who you are as a brand, I think the collaborations are great, and you see them on TikTok all the time. But I think looking outside of the box and trying to go to people and places and institutions that you're not, but that actually can use your products, benefits from your products or your ingredient, I think is a big opportunity for many of our brands in this space.
I think so, and it's interesting to think about how do we even talk to new markets and get to people early. I do believe that supply side is doing some work, bringing in students from the community and giving them the opportunity to actually learn from people, hey, maybe this is an opportunity for you. So can we get them when they're still malleable,
Absolutely.
I guess?
And one thing, it's health and equity, not education.
There we go, there we go, perfect, thank you. Chioma, you look like you wanted to lean in there on the microphone. She's like, I got something to say.
I want to add also.
Bring that microphone up.
Excuse
There
me,
we go.
I want to add that, when we're talking about addressing health equity, right, across the population, and then formulating in a way that the brand still can be profitable while delivering nutrients, valuable nutrients, that is accessible to everyone. So as a product development scientist, the way I would approach it is to understand, one is, what is the job that I'm getting done? What is the job that I like this product to do? And what is the mechanism that I'm targeting from a biomedical pathway? What is the mechanism I'm targeting? Then what are the ingredients? So I don't have to have a kitchen sink of ingredients. It's not necessary. But when I understand the biochemical pathway that I'm going after, then I can understand what are the key ingredients that would address the target. It could just be 2, and that's enough. So this idea of I have to have 10 ingredients for me to look complex and look good, it's unnecessary, and you can strip off costs from that standpoint while delivering value. And I think that's one practical way that companies can actually deliver value without incurring too much cost and make these products accessible to everyone.
I think that makes a lot of sense, because I do think when they look at the cost equation, it's really important, because why aren't supplements more affordable? Can we create quality supplements that actually are affordable for our target demographics?
Exactly. And even on that too, it's, yes, the branded ingredients may have a lot of clinical studies on them, which is wonderful. But companies may not be able to afford those branded ingredients and also make the product also very accessible to those that we need to reach, right? And so it's understanding, again, when you understand that biochemical pathway that I'm going after, then understanding what is critical, what are the chemical markers that drive to efficacy that I need to focus on. So even if I'm not using a branded ingredient, if my generic ingredient is still able to deliver to that efficacy because I've been able to link it, there's something called bio-directed fractionation, where you now use fractionation to determine what is the fraction that is most biologically active to go after. Then that now drives to me, okay, now I can use the generic ingredient and still reach to the same target without having to use the branded ingredient that will now drive cost up.
Right.
In some demographics, it might be okay to use that branded ingredient, but if we're looking at making supplements accessible to all, and I just described the health impacts that transcend beyond us to the generations after us, then we need to find ways and incorporate understanding the chemistry and the biological pathway that you're targeting in developing products that would then help everyone without the brands carrying on too much cost.
Yeah. I'm always shocked at how fast half an hour can go. But Sherry, I want you're like leaning in too.
Well, I just wanted to throw out one thing that, if you think about the last few years, right? Like, it was really interesting because the pandemic was one of those times where we saw more consumers coming to the case, right? So like, it was the first time that people came in, and you brought up SNAP at the very beginning, and one thing that we found with the incremental SNAP benefits during the pandemic, we actually saw in the data people ate healthier. They ate more fresh fruits and vegetables. Like, there is such a desire there. There's such an interest there. And so I was just thinking as you were talking, right, we've kind of had these moments in time where we've had opportunities to continue to bring those consumers into the space, but it is really about with the most applicable products as well.
Right. Well, yes, I have 2 seconds left. I know. But Marvin, Chioma, Sherry, thank you so much for joining me. Sandy, thank you to the supply side team for giving us this opportunity, and thank you for being here. Take the opportunity. It's out there. It's a great business opportunity for growth.
Yes, thank you so much. I have the clicker here. I just want to
yes.
call to a session that we have tomorrow morning on, why is this not working? Can I go to the last slide, or second to last slide? Here we go. Look, it's working now. We have an education session tomorrow morning. It's included in the price of your registration, so you've already paid for it, and it's on clinical trials. And we're going to be covering inclusivity in clinical trials like that we've talked about before, and it's not even on my slides. So sorry about that, but come tomorrow morning, it's downstairs, you'll see the education. Thank you.
Thank you.
Thank you.